Can we talk about how hooded out some of these nurses be looking nowadays? As I said before, I work in healthcare, I work in EMS. And so I come across a lot of nurses, CNAs, a lot of patient care techs, and a lot of healthcare professionals, just in general. And a lot of them are in hospitals, a lot of them are urgent cares, a lot of them are in nursing homes, some, LPNs, CNAs. But can we talk about how hooded out these chicks be looking? So not like nowadays, like I get some women are like naturally curvy and they're just like blessed with like this hourglass shape, and there's nothing wrong with that or the shape of the woman overall. But what is hood about it is like this the mannerisms, the demeanor, the attitude, the sassiness, the confrontational type of way in which you have like your manner of speaking and how you present yourself. You present yourself in a lot of times a lot of these women present themselves in a very confrontational kind of a way. And the majority of them that I see, I'm sorry to say it, they're black. And they straight out of Blackistan. And they have this hooded this hood type of attitude. And it really comes off very unprofessional and makes you question the capability or the intelligence of the person that is over your loved one or over your health care. And like I said before, it's nothing wrong with being curvy, but a lot of women go and get like BBLs and then they get these extra tight scrubs that like make their butts bounce around in the hospital, bouncing big ass down the hallways. A lot of them don't have any underwear on, and you can freaking tell they don't. And they have like this super, super long hair, super, super long nails. And it's no different, ladies. Like when you say like you see a guy who's like a cornball and he has like these gold chains around his neck, like 3 or 4, 5 or 6 different like chunky gold chains. And he has like this gaudy ass like labels, like it could be like a Gucci printed jogging suit jogger or whatever, these flashy Cartiers. Women think guys look like straight up cornballs when they dress like that, and you can tell that they're super insecure, and they're super insecure about like their money. They want you to think that they have money, so they have like the gold or the platinum teeth and the extra flashy diamond gold chains around their necks, because they want you to believe that they're rich because they're insecure about their wallets. Same thing with women. If you're insecure about your beauty, you're going to try to like sell it to everybody and make everybody believe and that you are this naturally sexy baddie, when being a baddie comes from within. Being rich comes from within. It speaks for itself. If you really have natural beauty, it wouldn't take extra exaggerated nails, exaggerated lashes, exaggerated hair, exaggerated asses. It wouldn't take all that. I mean, no shame for women who have work done, but it just really is like a time and a place to show that stuff off. And I don't believe that healthcare or the healthcare industry is the place for that. Same thing with guys and their money. It's a time and a place to be flashy, Now, in the healthcare industry in particular, you have to be smart about your choices with your manicures. You have to be smart about your choices with your lashes. I'm not saying don't wear them, and I'm not saying don't wear your makeup. I'm not saying be a plain Jane. I know women have style and they want to be, they have flair and they want to look good, and there's nothing wrong with that. It's just in a hospital, it's just so many things, like so much bacteria going around. And if you have like these huge, long, flashy nails with all these different embellishments on the top of your nails, you're going to pick up dirt that you might not be able to easily wash off. Dirt up under your fingernails when you're like changing a patient or when you're cleaning a patient, when you are dealing with blood, bodily fluids, stuff like that. When you're sliding patients over, you have like some patients, I'm not trying to be gross, but they have like skin shavings and skin cells that like are visible. Some are not. Some disperse throughout the air like little particles of dust, and they stick to your lashes. They can stick to your makeup if you don't use the proper protective equipment like face masks, eye guards. So it's important when you are in the healthcare industry to really think about that and take that into consideration and be smart about your choices. Pull your hair back, put it in a bun, put it somewhere, like cover it up with one of those bonnets when you're, at least when you're dealing with a patient. But I'm going to tell you about a couple of things that I noticed with the hood part of it. Is just sometimes that's just like very unprofessional. It's just very, just like a turnoff in general. Like if the family or, anybody, another healthcare professional sees another mutual acting in a very hood way. I mean, this just could be off-putting. Like, I was getting a patient who had an emergency from a nursing home to take them to the hospital. And, the nurses were all standing around. I think they were LPNs and CNAs, and they were just standing around like joking. And the patient was stable. I mean, it wasn't a lights and sirens situation, but it was, we had to address the emergency. It was something that was easily fixable, but still. But in situations like that, the EMS personnel has to talk with the nurse or the CNA, caregiver, whoever's in charge. And we went up to talk to her and try to figure out what the emergency was and kind of direct us as far as like where the patient is and things like that. And when I tell you, girlfriend had the Keisha Cole playing. She was shaking her rump to it. She was just kind of like, very sassy, giving us these little short answers that almost sounded like they were kind of confrontational a little. Like she was offended we were asking her about it. It came off very unprofessional. She had the long nails, she had the long lashes, she had the extra long hair, she had the attitude, and it just kind of low-key kind of irritated me a little bit. It kind of brought out my hood side a little bit, and I wanted to kind of return that energy like, girl, calm down. Like, what are you, why are you getting so, confrontational? Why are you being so short with us? I mean, we do have to ask what is going on, and it just makes you just put up your defenses like, what the hell? Like, who pissed in your Cheerios? I mean, none of us want to be here. I guess you don't want to be at work, but none of us want to be here, honestly. But I mean, we all have jobs to do. I mean, I love my job personally, so yeah, in case my bosses are listening. But I mean, it's just a turn off. It's just like, what? Why are you in this industry? Because it used to be a well-respected industry. People used to rely, they have to rely on healthcare professionals to know what they're doing and to be knowledgeable and to have good bedside manner and have good professional manner of speaking and the way they carry themselves. And it just kind of looks crazy when you have these extra long, baby hairs and lashes and this sassy ass attitude that's confrontational. Even when I used to work at a hospital, I noticed that there were a lot of, like, whenever the male patients would go in, especially during COVID, a lot of visitors were not allowed to go up with the patients. And girlfriends would call repeatedly the nurse's station not because they were checking on the patient, not because they were checking on their condition or the care. They were checking to see if their cheating ass boyfriends were like cheating with the nurses and stuff. And I guess with the way in which the nurses were dressing, I guess it gave off Jezebel vibes. So like the girlfriends were really insecure about leaving their boyfriends in the presence of all the women who had all that going on. And it's sad that it was like that, but it's just not appealing for a healthcare professional to carry themselves that way, and it's going to severely limit those professionals in their ability to climb if you look and dress and act that way, especially with the confrontational attitude, because for healthcare professionals, communication is key. We have to know what's going on with one another. We have to transfer care to each other. We have to be able to effectively communicate with one another. And if we come off like we don't like our jobs, we come off like we don't want to be there, if we come off like we don't want to talk to each other, and we don't care, or even the patient, if we don't want to talk to the patients and we don't really care what they have going on, is just not a good look at all, for yourself, for that team, or for the hospital. And it's just really sad that this is common for a lot of facilities. I remember we were dropping off we were doing a transfer because, it's EMS workers, so sometimes we do transfers too, in addition to 911 emergencies. But we were taking a patient from the hospital and taking them over to a psych facility. And this was a psych facility that was in an all-black area with an all-black staff. And they had us waiting like for maybe 30 minutes. They were very unapologetic about it. They were not accommodating to us or the patient. They just kind of gave us this whole thing like, well, I'm in power. I tell you when to come in. I tell you when to take the patient off of your stretcher. I tell you when it's okay for you to transfer care to us. We call the shots, and I don't care how you feel about it. I don't care that you didn't like that you had to stand there and wait for 30 minutes. You wait on us for however long you wait on us for however long you have to until we get ready to do what you want to do. I mean, that was the attitude. That's how it came across. It was not a very welcoming attitude. They asked the questions, and I guess they follow a script. I'm not sure, but it was just how they did it. That was just a complete turnoff, because in most cases when like a patient walks into a new healthcare facility, a rehab center, even a hospital, or just when they encounter a healthcare professional in general, you're a stranger to them. They don't know you, and if you come off like you're confrontational or like you really don't care, like you're following our script, that matters to the patient, and you have to make the patient feel welcome and make them feel safe and at ease. And you can start off by, introducing yourself. Hello, I'm Rebecca. I'm your healthcare professional for tonight. This is your CNA. I'm your nurse. You come to me if you want this or that done, or if you need something. How are you feeling tonight? Did you eat? Did you have dinner yet? Do you need anything? Okay, we're going to start off. We're going to do this. We're going to take your vitals first, and then we're going to do this next, and we're going to do that next, just to see how you're feeling, and just run a few tests and talk. You're going to sit down and talk with so-and-so, and they're going to do this, that, and the other. When you explain things like that, and when you introduce yourself and give them good eye contact in a very comforting voice, that helps them feel more at ease, that helps them feel comfortable, and they feel like they can trust you because you are giving them empathy and you understand what they're going through, and the fact that they are anxious about what's going on with them, and they want answers, and they need to know what's going to happen next. What are you looking for? And things like that. So that can make them feel more at ease. But when you come in and you just walk in and you just start putting the blood pressure cuff on them, and you haven't greeted the patient, and you haven't said anything to them, and you haven't said anything to the other person, like the healthcare provider standing there. You walk into a room, popping gum, and just roll in the blood pressure cart, and then you start taking vitals, and writing stuff down, and you don't tell the patient who you are and what you're doing. That is just a bad first impression, and they're going to be very dissatisfied with their care just based off of that by itself, because a lot of our patients do see that, and they anticipate a very uncomfortable visit. I'm going to be honest with you. A lot of patients do express anxiety when they see healthcare providers walk in like that. And you can say it's because they're black. You could say it's because the healthcare staff is black, or whatever you want to call it. But when you come in and I don't know you, and you have on these lashes and this long hair and these long nails, and you just walk up to me and start hooking stuff up to me, and you don't introduce yourself, there's no good bedside manner, they're going to express, under their breath, they're going to whisper to the EMS, or they're going to whisper to whoever's near them, like, oh my God, get me the fuck out of here. I don't know what, this is going to be horrible. I can see it coming. You got the Keisha Cole blasting. You got the Meg Thee Stallion blasting behind the nurses staff. Everybody's cackling and laughing, and everybody's wearing extra tight scrubs and slopping around the hospital and slopping around the facility looking like they're at home. And it's too much. It's too much of one thing and not enough of the other. Because as a healthcare provider, you do have to put yourself in the patient's shoes. Imagine if you were them. Imagine if you are there and you're in your hospital gown and you're vulnerable and you're surrounded by a bunch of strangers that have needles and that have machinery and things like that, right? They have all of these different things, these hospital equipment, like all these tubes, all of these things. I'm sorry. Put yourself in their shoes, you know? And if I see somebody walking towards me with a needle and you look like, I don't know, you have the extra hair and lashes, I'm gonna want to break and run. I'm sorry. Presentation is everything, so if you go into a meat market and you see a guy standing there and he's unshaven and he has on like this apron that's covered in blood with a meat cleaver in his hand, yellow teeth, and dirt under his nail, you're going to be thinking, hell no, I don't want you doing anything. Like, I don't want you handling my food. I'm going to go somewhere else where it looks like the person is more professional, it's a cleaner environment, and people who are clean with clean hands, I want them to, chop my meat and handle my food, right? So it's the same thing with a hospital or a healthcare facility, just in general. So presentation is everything. It's the way you look. It's your attitude, the way you speak, the way you move, the way you dress. All of that matters. So just kind of like tone it down a little bit if you can. I get people have their styles and people have their different personalities, but I'm just talking about just the hood way, the unprofessionalism, the attitude, confrontational stuff. That has to go. So that's my video for today. It's just a very lighthearted observation, but I love you guys. Don't forget to like, comment, and subscribe, and share the video, and let me know down in the comments what you think about this video, and also any of your experiences dealing with like hood people, like hood hospital staff. Have you witnessed any of these things that I talked about in the video? And if you have, please share them in the comment, because I could use a laugh. But that is my video, and I will see you guys next time.